Hello, my name is Rachit Sharma. I'm a PhD student in Environmental and Occupational Health at Drexel University in Philadelphia. So this work talks about the spatial variability in the acute effects of ambient air pollution and temperature on pediatric seizures and epilepsy across New York State. So the motivation behind this work was that the effects of air pollution and temperature extremes are not equally distributed. And what we wanted to see here was, do certain neighborhoods which are chronically stressed and have higher proportion of chronic stressors on an average, do they have stronger effects on a daily scale for PM 2.5, which is the pollutant of interest here, and temperature? So what we see here is across New York State at the census tract level, lag 1, which is a day preceding the case day for PM 2.5, the effects on pediatric seizures and epilepsy are stronger, and they vary across census tracts. Also for temperature, similar variation is observed, but for lag 0 temperature on seizures and epilepsy, emergency department visits. And we also observed that yes, there is spatial variation across these effects. And we tested this using spatial Bayesian hierarchical models. And eventually we wanted to identify which social stressors are explaining the spatial variability. So for PM 2.5 effects, we see that census tracts which had greater proportion of populations which speak English less well as recorded in the census had stronger effect of PM 2.5 on average, and census tracts which had higher annual murder rates, they also had stronger PM 2.5 effects. For temperature, what we observed is that census tracts which had greater proportion of population that was not white had stronger effects of temperature. So there are two takeaway messages. So one is that yes, there could be spatial variation across census tracts when it comes to the associations between PM 2.5 temperature and seizures and epilepsy. And number two, this spatial variation can be explained by social stressors. So these two things are important to take into context when we are designing air pollution and climate change interventions. Thank you.